Hi, I just wanted to ask about Indigenous communities. It looks like there's been 92 confirmed cases across the province. Is that on reserve? And is there a through line among these cases? You said proximate case info won't really help because it doesn't appear that neighboring residents have led to these the transmission on these reserves. Wondering if there is kind of commonalities between these clusters on reserve.
It includes all people who are identified as First Nations. So yes, it includes First Nations living in community and away from home. And for example, there were a number of First Nations people who were identified in the Federal Correctional Facility outbreak. So it includes all of that. And every story is slightly different. And that's where public health, the First Nations Health Authority, work closely with the community to investigate every single case that happens in community, and whether it's in an urban area or away from home or in the correctional facility and other places. So there's no one story. But I can say that we don't always know where, until somebody turns up as positive, where they got, where they were exposed. And sometimes the exposure event and the notification happen at the same time. So it's a very challenging situation. I mean, an example is recently a number of people attended a large memorial service and gathering, and there were exposure events that happened there. People returned to their home community and developed illness. So, you know, I have no way of knowing who was attending those events ahead of time. So it is a very challenging situation, and it's something we're trying to work on, because we know that it's this virus is carried in people, and it's when people move that we bring it to each other and to the community that we come from, and we bring that risk with us when we return home. So and we're most likely to pass it on to those people that we live with, that we have close contact with, and it's hard to quantify the risk by geography without taking into account the fact that it travels with people.
Mike, do you have a follow-up?
Yes, thanks a lot for that. I'm just wondering if you think this dearth of information on the ground is leading to problems. We have the Cathet Regional District saying that Tla'amin Nation members are being harassed in Powell River by people when they enter the community there. And there's a lot of distrust in that area because people don't really know about case numbers. So thoughts on just kind of, you know, the anger and perhaps distress that not knowing where exactly these cases are is creating in certain communities.
Yeah, and this is the challenge. It's not that we're withholding information, it's just that we don't necessarily know. And then we have to put a response together where people can be tested, where we connect the dots in partnership with the community. And this is every community. And it makes me very sad and concerned when I hear that there are bad things happening and the stigma associated with this disease. We have to remember that nobody intentionally brought this disease into our community or our families, and that we know how to deal with this disease, and we need to support each other like we do with every other illness that we have in our communities. And that means taking precautions, making sure that we're doing the right things, and making sure that we're supporting our family members, our community members, to stay home and have what they need should they have to isolate. And that's how we can support each other, and we all need to do that. This virus cannot tell the difference about where we came from, what country we're from, what ethnicity or race we are, and we all need to make sure that we are taking the anti-racist supportive approach with all of our friends and all of our communities.